Thanks, Dawn, and thanks for the opportunity to be here. After watching the two previous speakers, I think it is last and least, but we'll move on with that. Looking at the title here, this, I have to say, was one of the most difficult talks I've tried to put together, how scientific advances are being used to meet consumer needs in 15 minutes. So where I've gone about it is sort of a bit of reflection and try and touch on some topics that maybe will provoke some thought and conversation. But the first thing is, as Kendra said, what's really in the consumer mind? So there's a lot of things about the intrinsic characteristics of the products that they're buying. There's a lot of the extrinsic things, meaning the things like the marketing, the production system, welfare, and also there's how big a hole it's going to burn in your wallet or your purse. They're the things that consumers have to juggle with their purchasing decisions. I sort of look to a higher authority because this isn't really my area, and this is from a FAO website from someone who's a senior VP with the grocery manufacturers, and the question is his points on consumer needs. So these are his points. Consumers, and he used the words, have a right to expect that the foods they purchase are going to be safe and good quality, and also have a right to voice their opinions about the procedures that government and industry use to make sure that they've got those characteristics. The other comment he made was that the ultimate responsibility for investing the resources to achieve those standards lies with the industry. And a final point, that within certainly a market-driven economy, the industry needs flexibility in terms of how they go about meeting their requirements for efficiency and safety in producing the products that we're doing. Thought I'd just step aside here on the history of technologies, because we're looking about technology and science advances. So there's where we start out, me not happy, and there we are so much later, still not happy. So we've got to take it in mind that our consumers are humans, and we'll maybe never ever make them completely happy. Topic I've spoken about before is this idea of the paradox of progress, and last I looked, there's been 6 books written about this concept of the paradox of progress, and so I've just got a few of their key points. Some of them obvious. As we move forward as a society, we create more problems. Higher economic growth and consumerism lead to more stress, people work more, society falls behind. The better things become, the worse they are perceived. The more we know, the more we have to discover. And I think that goes back to Megan's microbiome talk, when we've got all these possibilities and a whole lot to learn. Just from industry, boiling and focusing down a little bit, there's 2 parts of this that I think are really important in this discussion. One is, as industry gets better, perceptions get worse. And on the other side, societal and industry evolution has created new problems. And so we have those sort of 2 forces on it as the industry evolves that are going to pressure the direction of the industry and what's acceptable, what's not acceptable, as Kendra's been speaking about before. Before we get too far ahead, and it comes back to the low-hanging fruit thing and consumers' wants and needs, I think a really missing piece is successful communication of successes and the fact that the industry has made progress. So this is data from the government on violative residues, market hogs. 1978, 5.6% violative levels for antibiotics, 9.7% for sulfonamides. They counted them separately. Now they're all antibiotics. If we look at 2016 market hogs, we have 2 systems. One's a true random sample, only 800, 0 violative residues in market hogs in 2016. And if we look at, they have another system, inspector-generated samples. That's when the meat inspectors think there might be a high-risk group, and 0.02% of violative residues in 18,000 samples. That's a phenomenal level of progress that nobody ever talks about. And if we were really going to be nervous when we had 1 in 7 animals going into the market in the 1970s with violative residues, we really had a problem that remarkably provoked almost no public outrage. It was public data. 2016 sows, just for comparison, again, a little bit higher in the sows for different reasons, but again, orders of magnitude below where the industry was operating 4 years ago. Most people don't know that. The other thing is just the whole issue of foodborne disease, and this is, again, CDC. Dawn will be familiar with this graph more than I am, but reduced incidence of key foodborne pathogens relative to a 1996-98 baseline. The one that goes up, Vibrio, is a seafood pathogen. The one that's about stable is Salmonella, which hasn't gone down, but with the other major meat-borne pathogens, 20 to 30% reduction, 50% reduction for Yersinia, which is pretty much solely a swine-related pathogen, substantial reductions in incidence of foodborne diseases. So our meat industry products, the evidence suggests they've got safer in the last 20 years rather than more dangerous. That doesn't often get communicated, and I'm sure if you polled the average consumer sitting next to you on the plane, they wouldn't realise that. Some other data in this, I'm fairly old, so some of these go back quite a long way, but these, again, published data, CDC, this is before the FoodNet era, but outbreaks per year linked to pork, and you can see what's happened in 5-year chunks. A pretty clear trend on the way the trichinella cases, which were, that 145-degree thing, Heather, was largely driven by trichinella. Trichinella is essentially not a pathogen in commercial pork production anymore. It was a major public health concern 50 to 80 years ago. Toxoplasma, again, a very important foodborne pathogen. With changes in production systems, we can see these, again, national level serological studies. We have a very low prevalence of Toxoplasma titers or exposure in modern industry. And the final one is just FSIS Salmonella standards, the carcass testing done by FSIS showing that we've reduced our average prevalence of carcass contamination was 8.6% in the middle of the 1990s. In our larger plants, it's been below 1% for several years. So order of magnitude of improvement in carcass quality, carcass contamination. Again, does the consumer need to know this? Does the consumer want to know this? But again, it's this issue of perceptions of where the industry's going, maybe clashing with a little bit of the reality on some important, measurable attributes of where the industry's at. So I'm not talking about resistance yet, but I will now. And these are some of the points that as I look through it, what really matters. Are the food animal industries doing harm? How much? A big question. How are we using antibiotics in food animals? Again, as Mike brought up, what's effective, what's necessary, what's philosophically defensible? Growth promoting usage, even if it was doing no harm, is not philosophically defensible in our country or internationally at the moment. So regardless of what it's doing, it's not something we can defend and will have pressure on some of our other uses. How good is the evidence in terms of the detrimental effects on human health versus the positive effects on animal health and animal welfare? Not as good as we'd like. I think a really important thing in the animals industries is let's stop debating about how much harm we do or don't do, but focus on doing things better. And I think we've seen that with Heather and with Kendra and the earlier presentations. The industries are moving forward because they know this is a really important area to progress to get better. Oops. Gone one too many. And one of the big issues is particularly on this issue, how do we measure and communicate progress? Now I just want to switch to reducing the impact of antibiotic use in food animals on animal health. And I sort of generally tell people it's greater than zero, whatever it is, therefore we have to be moving forward to address it. So these are some bullet points that have been suggested by others or of how we can reduce that impact. And I'll go through them. Reduce consumption of animal products, reduce contamination of animal food products, reduce the important bacteria in the live animal sector, or reduce the selection pressures on them from antimicrobial use in the on-farm sector, either by restricting use, optimising use, or, as mentioned before, things we do to reduce the need for treatment. And I'll talk through some of those. Reducing consumption of animal foods is sort of an interesting one. And this is a quote here. I don't know if many of you are familiar with Brad Spellberg. He's an infectious disease clinician in California. So his quote is, as a society, if we want to reduce selection of antibiotic-resistant bacteria, we should be consuming less meat. This has had insufficient attention at the level of national health and commerce policy. So he's putting that idea out there. I don't know how much he believes, or others, that they would have a measurable impact, but it's putting out there I think it's just something we need to have in our conversation because others are putting it there. These are just some news items that I pulled a couple of months back. One side is that meat and poultry are holding their own despite new trends and alternatives, so our consumers are still wanting our products despite all the noise about them. But on the other side, something we can't ignore, I think is really important, global meat substitutes market to exceed 6 billion. So I think we really need to be cognizant of the technological change that's going on in alternative food production. My proverbial conversation in the aeroplane on the way here down here was a young woman, very nice young woman from Indianapolis, who is a vegan, but she eats fish and eggs. So sort of a vegan. But we had a conversation about the Beyond Burgers, and she was just swearing and that they were just the greatest thing and were just like a real burger. I haven't tried one yet, but I've had a number of people say that. So competition in the protein markets is going to get a lot more diverse, and some of those options will have competitive advantages on antibiotic use. I think reducing contamination in animal food products from a point of view of research and technology, this isn't my area, but this is a review of all the new tools and technologies which will be more or less acceptable in different societies from a point of view of what we're allowed to put on and play around in our processing areas. But things like intelligent packaging, high processor processing. So there's a lot of technology development that could look at shelf life, microbial inhibition in the storage products that will influence the impact or the survivability of bacteria that are coming from the farm or processing environment. The big one, and I've been around this for the last 25 years or so, is let's just control the foodborne pathogens on the farm. What I'll say about that is a whole lot easier said than done. A lot of these priority pathogens are normal flora or commensals in the food animal species, and it's unlikely that you're going to change the biology very much by washing the floor or doing what I call facile interventions in management are not going to change the flora of the animals. So the holy grail is still what can we do about these organisms on the farm. I think there's lots of opportunity there for alternative products, but they need to work, and they need to work all the way through to slaughter. They need to be reproducible, they need to be generalisable. I think certainly on the swine side yet, there's always a lot of promising products, but we're not there yet. But I think that's a huge opportunity for research technology going forward, but don't hold your breath because we've been holding our breath for 20 years. Reducing selection pressures. Again, we've talked about just the regulatory hammer of saying let's bring it down and ban antibiotics or remove. Obviously, we've had the conversation about the need for alternatives. As Kendra, I think, mentioned, that path hasn't been that simple. The alternatives also need to mitigate resistance. The biggest example we have in zinc, and zinc with MRSA, so the most accepted alternative to antibiotics is in Europe has been the use of zinc oxide in weaned pig diets. Widely used. It's now being banned in Europe for two reasons. One is environmental considerations, and the other is the fact that there's a zinc resistance gene that's on the same cassette as the MEK-A gene in MRSA, and therefore it's seen as co-selecting. So our alternative to antibiotic is a feasible selection pressure for the bacteria we're trying to not have in there. So these things are complicated. So the optimisation comes back to our reduction antibiotic stewardship people have touched on there, and reducing the need for antibiotic use in food animals. And this is where I think some of the exciting technologies like Megan was talking about with creative interventions that really affect animal resistance. So age-old ones are improving household management. We've got options for big data, for monitoring, environmental monitoring, for monitoring animals, for detecting disease earlier. I don't know where that's going, but again, technology with sensors and integration of data is going to open doors to new options. I think probably as a pig person, the most exciting area is improving host resistance, and particularly with gene editing. We've now had 2 groups that have developed gene-edited pigs that are resistant to the PRRS virus. You've heard PRRS mentioned before. It is the top 3 most important diseases in the pig industry. These pigs are, by modifying the receptor on the macrophages, the pigs just don't see the virus. The virus doesn't replicate. So we have a whole challenge in terms of legislating, in terms of permitting, transferring what is, I think, really exciting technology to improve host resistance that could really have a monumental impact on the need for antibiotic use, in this case in the swine industry. There's also another group that's produced transmissible gastroenteritis virus free pigs as well, so that again the pig doesn't recognise the virus. So I think that's a potentially really important thing. And again, products that promote health, the alternative things, particularly in vulnerable populations, there's lots of opportunity there. Coming up with the silver bullet we'd like is desired, but again, a whole lot easier said than done. So just to wind up, a couple of quotes. What does the future look like? The past is a foreign country, they do things differently there. It's a quote from L.P. Hartley, so I'll argue, so therefore is the future. Whatever we're doing now, we're going to be doing it a little bit differently, and let's hope the things that drive our new directions are focused on the animal, focused on the tangible properties of the products that are beneficial to consumers, rather than perhaps some of the more nebulous wishes in the mind of the consumers. And another quote I like is that the future's already here, just unevenly distributed. So there will be groups moving forward on these areas that are already there. Thank you.